So hello friends, we have started with a new chapter, that is communication of health education, and today we are learning about the various model of health education. Many questions are asked from this topic, so let's get started. So what is health education? Health education is not just about giving information, it is a process that aims to encourage people to want to be healthy, to know how to stay healthy, and to act in ways that maintain health individually and collectively, and also to seek help when needed. So, there are three models of health education: medical model, motivational model, and social interventional model. We'll learn about each model in detail. So first model is medical model. Medical model primarily deals with recognizing diseases and treating them using scientific methods and medical technology. It is more disease focused. This model places a strong emphasis on the scientific fact. So it is about dissemination of the information. So the assumption here is that if people are informed about the health risk, they will change their behavior. For example, if we tell people that smoking causes lung cancer, the model assumes that they will stop smoking. But medical model, it doesn't consider the social, cultural or the psychological factor that influences a person's behavior. So even if a smoker knows all the fact about cancer, they might continue smoking due to stress, peer influence. So information alone doesn't guarantee action. That is why the medical model, it doesn't bridge the gap between knowledge and behavior. The second is motivational model. So now why this model was developed? Because people often don't act on information alone. Just knowing smoking is harmful doesn't mean a person will quit. So the motivational model was introduced to explain how a person goes from being completely unaware to finally adopting a new healthy behavior. This model suggests that behavior change is a process and the person moves through 7 stages. These stages are not rigid. There may be skipping of stages. At a given time, people from the same community may be in different stages of adoption. So this model relies on the individual alone. However, if there are certain complex problems like adopting small family norms or vasectomies where group support is important, this model might not be useful. So the first stage is unawareness. The person is unaware about the subject either completely or may have some incorrect information. Then the second stage is awareness. In health education, we must first create awareness of health needs and problems through a program of public information. The person gains information either through listening to a health talk or reading information. Then he becomes interested. The person becomes interested and tries to learn more about the subject by collecting detailed information about it, about the usefulness, limitations, or the applicability of the new idea or practice. He then evaluates the various aspects, the social, psychological, economic, of the information he received. If necessary, he can consult others also. Such an evaluation is a mental exercise and it results in decision making. He finally decides whether to accept or reject the new idea, program, or proposal. At this stage, interpersonal communication with friends, groups, technical person is vital to lend support to his decision. That results into action, adoption, or acceptance of the new idea. The new idea or the acquired behavior becomes a part of his own existing values. That is known as internalization. Effective communication strategy should be evolved to help the individual in passing from one stage to another. The next is social interventional model. Soon, however, it was realized that the public health problem facing us today are so complex that the traditional motivational approach is insufficient to achieve behavioral change. For example, reducing smoking, adoption of small family norm, raising the age of marriage, elimination of dowry, etc. The motivational model ignore the fact that in a number of situations it is not the individual who needs to be changed but the social environment which shapes the behavior of individual and the community. It is often found that people will not readily accept and try something new until it has been legitimated or approved by the group to which they belong. Most of us prefer to do only the things commonly done by our group. This highlights the importance of group support in helping reaching the decision and taking action. Adoption of new ideas such as vasectomy or tubectomy is facilitated if there is a group support. This gave birth to the development of social interventional model of health education. An effective health education model is based on precise knowledge of human ecology and also the interaction between cultural, biological, physical, and the social environmental factors. So with this, we have come to an end of this lecture. If you found this video helpful, like it, share it with others, and subscribe for more.